And there's new hope for the scores of people who are vulnerable to malaria. Clinical trials of an experimental vaccine show that it could save millions of lives. At the same time, many are expressing disappointment with the trial's effectiveness. Nevertheless, it's expected to help significantly in the fight against an illness that currently kills more than 800,000 people every year. Joshua Blumenfeld is Managing Director of Global Policy and Advocacy for Malaria No More, and he joins us from Washington, D.C. Welcome to Arise America, Joshua. Appreciate you being here.
Thank you so much for having me.
So malaria is said to threaten half the world's population with 100 countries affected. That's a huge number. Can you kind of paint the picture for us of the global impact of this disease?
Absolutely. So interestingly, malaria is one of the oldest and deadliest diseases known to mankind. It's been around since the dawn of history. About 200 million people get sick from malaria each year, and about half of the world's population is at risk. So it's an enormous burden that really covers an enormous amount of people.
It's my understanding that we see 90% of the deaths in Africa. First of all, why is that? And second of all, what needs to be done to target this problem?
It's a great question. There are a whole slew of reasons why that is, from geography to the actual parasites themselves, to the strength of health systems, to farming practices, etc. But the good news is that quite a bit is actually being done. About $3.2 billion is being spent every year to combat malaria, led in large part by the United States, and we're seeing enormous progress being made. So we used to live in a world where a mother or kid died every 30 seconds from malaria. Now that's down to once a minute. So we're really saving a lot of lives. 4.2 million lives have been saved in the last 15 years.
Well, speaking of progress, there is a malaria vaccine that's being developed. Where are researchers on this, and when can we expect to see it really making some gains on this disease?
Sure. So it's a great first step. I don't think it's as effective as everybody had hoped, but yeah, and it's certainly not a panacea, but it's going to be one of the absolutely necessary tools that we're going to use to eradicate this disease from the face of the planet. And it just goes to show that R&D is an absolutely essential part of this fight. And it's a public-private partnership. It involves pharmaceutical companies. It involves researchers from endemic and donor countries coming together to innovate and find the tools that will enable us to fight the disease.
I'm going to hit you with this softball, Joshua, on this eve of World Malaria Day.
Yeah.
For most of our viewers that are in the United States particularly, they will never come in contact with malaria or know anybody that gets it. I've known a couple of people because they went on mission trips.
Sure.
So why should this be in the consciousness of Americans or Westerners that generally don't deal with this disease?
It's a great question, and I'm so glad you asked it for a couple reasons. One, it's in our vital national security interest. Malaria is a devastatingly destabilizing disease. It has dramatic economic effects on countries with which we engage and trade. So it's absolutely essentially in our interest. It's also a humanitarian intervention. It says a lot about who we are as Americans. And, in a time when we have so many seemingly intractable problems and when our government seems not to be able to accomplish anything, we have actually made staggering gains on malaria. And that is in large part to the well-run, efficient, and effective programs of the President's Malaria Initiative and other institutions. So this is something that Americans should be proud of. It's cost-effective, and it has huge positive impacts on the communities.
Joshua Blumenfeld, thank you so much for your time. Appreciate it.
Thank you.
And coming up next on Arise America, reporters join me to discuss some of the biggest headlines of the news week. You don't want to miss that.